In part 1 of Mealtime and Swallowing, I reviewed tips for meal setup and listed some foods that are easier for people with Parkinson's to chew and swallow. In this video, we will address ways to manage dehydration, weight loss, and problems swallowing medication. Dehydration can occur if the person with Parkinson's does not get enough fluids. Some symptoms of dehydration are confusion, low blood pressure, and dizziness. Make sure your loved one gets 48 to 64 ounces of liquid daily. This means 6 to 8 glasses of liquid per day. Since liquids are filling, you will need to encourage your loved one to drink throughout the day. One easy way to increase liquid intake is to drink 8 ounces of water with each dose of Parkinson's medication. Since most people take medication several times per day, if your loved one drinks a glass with each medication dose, he will get enough liquid. Some foods like fruits, vegetables, jello, and ice cream have higher liquid contents. You can count the liquid in these foods toward the overall daily fluid intake. In people with advanced Parkinson's, weight loss can occur because of problems swallowing. Choose calorie-dense foods such as gravies, whole milk, and butter to add calories and help increase weight. High-calorie drink supplements can also help add or maintain weight. Check nutritional labels on supplements. Look for high-calorie, not high-protein drink supplements. Some brands come in powdered form, so you can mix your own drinks using milk with higher fat content. You can blend a nutritional smoothie using pre-mixed or powdered supplements, adding fruit or syrup for flavor. However, try to avoid giving these supplements at the same time as Parkinson's medications. If swallowing medications with a liquid is difficult, give them an applesauce. They may need to be crushed. Most Parkinson's medications can be taken this way, except controlled-released carbidopa-levodopa and other long-acting formulations. Crushing long-acting carbidopa-levodopa will change how it works. Avoid giving Parkinson's medications in pudding or ice cream. The protein in these foods, like in the smoothies we just talked about, may interfere with the absorption of Parkinson's medication. Carbidopa-levodopa might also be available as a tablet that dissolves under the tongue or as a gel that is delivered through a pump to the intestines. Consult your doctor or pharmacist if your loved one cannot swallow whole medications. Report to the doctor if coughing, choking, or recurring lung infections occur. They may refer you for consult with a speech-language pathologist for a swallowing evaluation. This evaluation may show needed changes in food consistencies, such as thickened liquids, to prevent swallowing problems. If swallowing is a concern, you may also want to attend a Red Cross class to learn the Heimlich maneuver, so you can be ready in case of an emergency. When swallowing becomes very difficult, a feeding tube may be considered. This is a choice that should be discussed in advance with the person with Parkinson's, family members, and the healthcare team. There are several types of feeding tubes for different purposes. Review the person's health history and physical needs so you can choose the safest and most appropriate type of feeding tube and administration methods for nutrition, water, and medication.